I'm Kain. I'm a current third year medical student at Emory. And today I'll just be presenting on what we found on the association of psychosocial risk with readmission and LVAD patients here at Emory. So for those of you who don't know, an LVAD is a left ventricular assist device. And this is a battery operated mechanical pump that we use for patients who have reached end stage heart failure. LVADs can be used as bridge to transplant therapy, or it can also be used as destination therapy, which is what we call it if transplant is not possible, but long-term LVAD use may prolong and improve the patient's quality of life. A third category has also become more common recently, and we call this bridge to consideration, which describes LVAD use for patients who have undetermined candidacy for transplant. But whatever the type of intervention, care of LVAD patients is very complicated and it requires significant patient engagement with frequent follow-up appointments and very intricate medication regimens. This can frequently contribute to repeat hospitalizations, which increases morbidity, can decrease quality of life, and add significantly to healthcare costs. Therefore, being careful about candidate selection requires a comprehensive medical assessment as well as a very multidisciplinary determination of one's psychosocial risk. Currently, Emory Healthcare is the #1 LVAD implanting center in the United States, and it therefore serves an extremely diverse population of patients who come from not only the surrounding Atlanta area, but also more rural and underserved regions of Georgia. So we sought to use this as an opportunity to characterize the burden of psychosocial risk factors on readmission among LVAD patients here at Emory. So for the study, we did a retrospective chart review of all patients with an LVAD who were readmitted for any reason at Emory for about a year-and-a-half time course between 2021 and 2022. We collected various baseline demographic info such as age, sex, ethnicity, insurance, how far they lived from the hospital, the type of cardiomyopathy they had, the type of LVAD device they had implanted, as well as their psychosocial risk factors if they had any. And for the purposes of this study, we defined psychosocial risk according to domains that have been used in validated assessment tools that are used to evaluate LVAD candidates for treatment adherence. And these domains included limited social support, limited cognitive understanding, substance abuse, psychiatric disease, as well as repeated noncompliance. So for our results, in Table 1, you can see our reported baseline characteristics from our study group, which totaled to about 60 patients with an average age of 53, mostly being male sex and African American. And they had either a HeartMate 3 or a HeartWare device. About half of them received LVADs as that third category I mentioned earlier, bridge to consideration, and more than half of them had no insurance at the time of readmission. Only about 63% of patients lived within 50 miles of the Emory Hospital, and very notably, 1 in every 3 patients with an LVAD readmitted for any cause during this time had a recorded instance of at least one psychosocial risk factor, the most common of these being psychiatric disease, followed by noncompliance and a lack of social support. This is interestingly a higher number than previously reported in a study published by the American Heart Association in 2020, which reported that 1 in every 5 patients had at least one psychosocial risk factor. We also classified patients as being in either a high or low readmission category based on a median split of about 4.5 readmissions over the 1.5-year time course. For the 1 in every 3 LVAD patients that I mentioned who possessed psychosocial risk factors, 91% of them happen to fall into the high readmission category. Finally, if you observe figure 3 at the bottom, you'll see that while patients with psychosocial risk factors consistently were classified as high readmission, patients who lived farther away from the hospital and were uninsured were actually readmitted less. Also, among a total recorded number of 270 readmissions among all the patients during this time course, infectious related causes made up about a third of the cases, and cardiac complications made up about a fifth, which is consistent with our previous studies. So in conclusion, we demonstrated that there may be significant burden of psychosocial risk contributing to long-term complications and readmission for patients on LVAD pump support. Previous studies have actually shown that while patients on LVAD therapy with psychosocial risk factors have an increased risk of complications and readmission, they have similar rates of mortality as those that do not. Therefore, withholding LVAD therapy or raising the acceptable threshold of patients being considered for LVAD isn't necessarily the solution. Rather, we may be able to mitigate these risks by developing systems of support, providing access to addiction medicine, and broader mental health resources as well, which may also help to improve their candidacy for transplant, moving them from that third bridge to consideration category to the bridge to transplant category. These findings are descriptive in nature and they don't necessarily demonstrate causality, but the fact that while patients with psychosocial risk factors are consistently readmitted more, that patients experiencing other risk factors like having to travel further or residing in rural or underserved areas or having no insurance were actually readmitted less suggests that these patients may be facing additional barriers to seeking care that can lead to a potentially underreported number of complications in these cohorts. That's all I have for you guys today. Thank you so much for listening.